Hi there, I'm Emma Holly from Restore Therapy, and this is just a short promotional video about the Sharon Wheeler's ScarWork certification course that I ran. My background's in massage therapy, and for many years I was working with people who had pain issues, and then for the last 5 years I've been specialising in treatment of scar tissue, and it's really expanded both in terms of the interest that there's been within the therapy and movement community around scars and scar healing, but also in patients wanting to get the best out of their recovery. I'm one of just a couple of accredited tutors within the UK who runs the Sharon Wheeler's ScarWork course. Sharon Wheeler is an American therapist who for the last 45 years has been developing techniques to help improve scar tissue. I love being able to share these techniques because quite quickly they can bring a change in the patients that we work with. I've been working locally within breast cancer care for a while. I've now got oncoloplastic consultants who put the wonderful comments saying that really they think scar therapy should be available to every woman after breast cancer, thanks to the work that I've been doing with some of the patients there. Similarly, I've got experience working within sort of sports and sports injuries. I've done, for the last few years, I've been helping out with the Invictus athletes since 2017. We had the most phenomenal year taking a team of ScarWork therapists to support them at the Sheffield's Games, which was the second ever biggest disability sport event in the UK had ever held. And so I've got a really diverse background in terms of what I'm able to bring to the learners who come along to the course, no matter what it is that they like to specialise in their practice. The Sharon Wheeler ScarWork course is a 4-day training. What's absolutely unique about the way that we run the course is that the training includes clinics where members of the public come along and get treatment on their scars. Even when people are still learning, we get amazing results. Take a look at a couple of these comments. Isn't that fantastic? So learners, even while they're still undergoing the training, can really make a difference to people and help them with their scars. Sometimes there can even be visual differences in the scars as well. And here are a couple of photos that learners have taken before and after treatment with them. These are just single treatments that go on in the supervised clinics. What we would normally expect is over a longer term that with multiple treatments many people are getting improvements with their scar tissue, and we love to share the thoughts and concepts around working with scar tissue. Scar tissue is different from pre-injury tissue, so whether or not you work with women who've had C-sections, hysterectomies, endometriosis surgery, breast cancer, or whether or not you work within sporting field, maybe you're working with runners, joggers, people who've had arthroscopies, ligament repairs, tendon recovery, it doesn't matter, because many of the people that you work with will have some scar tissue, and perhaps you've been underestimating the impact that that might be having on their holistic body. When you have scar tissue, it tends to be more fibrous and not want to move as freely as the surrounding tissue. The fascia can quite commonly be impacted, and a pull through the fascia, particularly whether it's round a joint or round like the abdominal and pelvic region, can have cascading effects either up or down the body. When we come and teach people how to use the Sharon Wheeler's ScarWork, it's always talking about how to implement these techniques and build them into your therapy practice. It doesn't matter whether or not you're a sports therapist or a physiotherapist, if you practice osteopathy or acupuncture. If some of your patients have scars, and it would be surprising if none of them do, then these are techniques that you can build into those treatments that you're giving in order to bring some change and stimulate some further healing in scar tissue, even decades after the scar was formed. What I really love about teaching this course is how, by pooling people together, bringing people into the room with different specialities, we can learn from each other while also discovering how the different impact of scar tissue has affected people, whether it's the learners on the course or the members of the public that come along to those clinical sessions. We have 3 clinics with members of the public, and it's in this time that you're really putting those techniques into practice. No 2 scars are alike, so it's very important to try out those techniques on different types of scars in different areas of the body, perhaps with people who have multiple scars, and see how the scar tissue interacts. Often surgery or injury that's occurred through the abdomen and pelvis has adhesions, so this is sticking. The sticking that's caused by adhesions can have cascading problems around the body. It could be affecting an organ, so perhaps somebody has got bladder irritation as a result of pelvic surgery, or perhaps they've got hip pain or weakness through their abdominals because of a C-section surgery. Looking at all the different ways in which scar tissue may be affecting and impacting the people that you're working with will be a good way of taking these tools back into your business, back into your clinical practice, and thinking about different ideas for bringing change to your patients. This light touch work of Sharon Wheeler's ScarWork is delightfully healing. It's wonderful to share. The therapist can sit, they can stand, so it's very protective of your body, of your hands. We're not looking to strain the body, we're not looking to push through pain. We're working with our patients, with our clients, to try and encourage their body to reconfigure the tissue in a way that is more functional for the individual. I can't wait to share the course with you.